Blood supply of the spinal cord. One spinal, one anterior spinal artery, which is a branch of fourth part of vertebral artery. One anterior spinal artery, which is a branch of fourth part of vertebral artery. Two posterior spinal artery, branch of fourth part of vertebral artery, supplies the posterior one-third of the spinal cord. And the third is spinal branch of second part of vertebral artery, deep cervical artery, posterior and the lumbar artery. And the fifth one is anterior radicular artery, and fifth is posterior radicular artery. These are the blood supply of the spinal cord. So first anterior spinal artery, then two posterior spinal artery, one anterior spinal artery, two posterior spinal artery, anterior radicular artery, posterior radicular artery, anterior radicular artery, posterior radicular artery, spinal branch of intersegmental artery. These are the spinal branch of intersegmental artery, which divides into anterior radicular artery, posterior radicular artery, and there is anterior spinal artery and the posterior spinal artery. These are the branch of spinal cord. What are the muscles of mastication? In muscles of mastication, it moves the mandible during mastication and speech. It moves the muscles of the mandible during mastication and speech. There are four muscles: temporalis, masseter, medial, and lateral pterygoid. Masseter actually elevates mandible. Temporalis elevates mandible. Masseter clenched teeth. Temporalis retract the mandible. The lateral pterygoid and the medial pterygoid. Lateral elevate and protrude the mandible, and side by side movement. Elevate and protrude the mandible, and it causes side by side movement. Development is mesoderm of the first branchial arch, mesoderm of the first branchial arch, and it is supplied by a mandibular nerve. It is supplied by mandibular nerve. So masseter, temporalis, medial, and lateral pterygoid.